Consumer Watch. Some of the largest generic drug companies are being sued in what could be the biggest price-fixing scheme in history. On Friday, more than 40 states and Puerto Rico filed a 500-page lawsuit accusing drug makers of conspiring to raise costs. Meg Oliver has more on the story, first brought to you by 60 Minutes.
20 of the biggest generic prescription drug makers are accused of committing a multi-billion-dollar fraud on U.S. consumers. 43 states and Puerto Rico filed a complaint Friday alleging the companies coordinated to inflate prices and reduce competition on more than 100 generic prescription drugs.
This is an attack on the American people. It's a massive fraud that focuses on the drugs that we take every day.
Connecticut Attorney General William Tong, who is leading the state's coalition, appeared on CBS this morning. He was featured last night on 60 Minutes, where correspondent Bill Whitaker talked to Tong's investigator Joe Nielsen. Nielsen said the evidence is in company emails, texts, and phone records.
We can see that competitor A is talking to competitor B 5 times on one day.
It all snapped into sharp focus when he matched phone logs to thousands of text messages from Heritage Pharmaceuticals. Nielsen says this exchange with competitor Citron Pharma showed collusion to increase the price of a diabetes medication. The text messages implicate 2 other companies, Aurobindo and Teva, the world's largest generic drug maker. The national accounts manager at Heritage wrote, "We are raising the price right now. Just letting you know, Teva says they will follow. Aurobindo agrees too." A corporate account representative from Citron answered, "We are definitely into raised pricing, are doing this immediately." The Heritage executive responded, "We are raising our customers 200% over current market price."
We want to claw back the money that they stole from the American people.
The drug companies deny engaging in any illegal collusion, saying prices go up with drug shortages and market forces. In a statement to CBS News, the Association for Accessible Medicines, a trade group which represents generic prescription drug companies, says it and its member companies are committed to supporting policies that promote competition. It also notes that prices have declined overall in the last 3 years. Meg Oliver, CBS News, New York.
Maryland is one of the states involved in the lawsuit. Attorney General Brian Frosh joins us now from Baltimore. Brian, thank you so much for being with us. Why did you initially decide that Maryland should join this class action lawsuit?
Look, we have been after these spikes in generic drugs for several years. In the market, when a drug comes off patent and subject to competition, the price drops by a lot, usually in the range of 80%. And what we've seen instead are these massive increases, and hard to explain because they're not justified by costs of production or costs of marketing. They're drugs that have often been on the market for decades. And it hurts Marylanders. It hurts every patient in Maryland. And the drug makers are making huge profits. And this price-fixing conspiracy is one that we have been attending to for several years. It started out as a smaller case, but has exploded, and it probably isn't done. And the cost to our folks has been in the billions of dollars, and the profits made by the drug manufacturers have been billions of dollars.
And so what is your hope then to accomplish with this litigation? Would you like to return some of that money to the citizens?
Absolutely, we want to return the money. We're asking not only that the drug companies disgorge their profits, but also that they pay treble damages and that they be enjoined from future price fixing.
It is pretty amazing when you see sort of the email chain that we just watched in Meg Oliver's package there. I mean, that seems to be, obviously it's out of context, but that seems to be a pretty clear case of representatives from at least 3 drug companies talking about pricing. Can you give our viewers a sense of just how much more some of these drugs cost as a result of this alleged scheme?
Yes. Many of them have gone up in price by hundreds of %. and several or many, 1,000%. One, a common drug called nadolol went up 2,700%. So if you were taking nadolol years ago, it probably cost you $10 to $20 for a 3-month supply. The price jumped to over $500. Huge price increase for folks who need this blood pressure medication. And the same is true, we allege, for around 100 other drugs. And look, we're not done investigating. We think there's more to come. But it means great damage to every person in the United States.
And according to the complaint, the Israeli drug company Teva Pharmaceuticals is allegedly at the center of this scheme. Can you explain their role in all of this?
Teva seems to be the company that began to coordinate this. They said they wanted to have everyone play nice in the sandbox, and they wanted everyone to get their fair share. So what they did was, when new companies went into the market, or when a new market opened up, they divided it up. And it would be 50-50 if there were two, 33% for all three, 25% for four. And they would raise prices in conjunction with each other. One company might raise its price first and the others would match it. And they did that to increase their profits without hurting their market share.
And so since these types of lawsuits take typically a long time to unfold, what is your outlook on how all of this will play out?
Well, it will take some time unless the drug companies come to their senses and reach a settlement. It will take us a few years, but ultimately we're going to make them stop and we're going to make them disgorge their profits.
All right, Maryland Attorney General Brian Frosh, we thank you so much for your time.
Pleasure to be with you.